Welcome to the Deep Dive.
Good to be here.
Today, we're taking a closer look at a particular resource. It's aimed at medical professionals, specifically those navigating the incredibly challenging field of trauma care.
That's right. We've been digging into some source material describing a book by Dr. Atef Ahmed. It's called 100 Questions and Answers in Advanced Trauma Life Support.
Okay, so Dr. Ahmed's book. Let's dive into what this actually offers and maybe why the material we looked at highlights it as, particularly valuable for people managing trauma.
Well, first off, trauma care is it's inherently complex, isn't it?
Absolutely. Intense.
Yeah, intense. It demands really rapid, precise decisions, often under immense pressure, too, and maybe you don't even have all the information yet.
Right.
So the source material really frames this book as a tool specifically built to support professionals right there in that high-stakes environment.
And the title itself, 100 Questions and Answers in Advanced Trauma Life Support, kind of gives the game away, doesn't it?
It does.
Tells you immediately it's built around that Q&A format and focused very squarely on ATLS, Advanced Trauma Life Support Principles.
And the material we saw emphasizes this isn't, just any Q&A book.
Okay.
Its stated purpose, its goal, is to be really precisely tailored. Tailored for those medical professionals dealing with those complex moment-to-moment decisions we were just talking about.
Got it. So this is where it gets interesting, looking at the why behind its design, according to the source anyway. They seem to highlight several key features. First up is this idea of comprehensive coverage.
Yes, exactly. The description suggests it takes these complex trauma concepts and really distills them, makes them manageable.
How so?
Well, it apparently covers the whole spectrum, right from that absolutely crucial initial assessment of a patient.
The ABCDEs and all that?
Presumably, yes. All the way through to complex critical care decisions later on in the patient's journey. So it sounds like it really aims to give you a kind of a complete picture of the whole trauma management pathway.
And that Q&A format.
Yeah.
That seems pretty central, but there's something else the source pointed out about it.
Absolutely. So the material says this format, the Q&A, is specifically designed for enhanced learning and, importantly, retention, making it stick.
Okay, makes sense. Active recall and all that.
Right. But the really crucial part, the bit it highlights, is that each question isn't just followed by the answer, like A is the answer.
Yeah.
No, it includes a detailed explanation. It doesn't just tell you what the answer is, it actually dives into why it's the correct answer.
Yeah, okay.
Really elaborating on the underlying ATLS principles behind it.
So it's not just about memorizing the steps, it's about understanding the logic, the reasoning.
Precisely. That seems to be the idea. So, for instance, the source implies that rather than just asking, what's the first step in a trauma primary survey and giving airway,
Right.
the book would then apparently explain the whole rationale. Why prioritize the airway? What specific things do you assess? What are the immediate interventions you might need? Grounding it all really deeply in that ATLS logic.
That depth of explanation for every single question, that seems to be presented as a core selling point.
Yeah, I can see how that would be valuable. And in a field like trauma care, which evolves so quickly, staying current is just non-negotiable, isn't it?
Totally. And the source material really emphasizes that the book is up-to-date and evidence-based.
Okay.
So integrating the most recent guidelines, the latest research that's specifically mentioned. Think about how often ATLS protocols or maybe resuscitation guidelines get updated.
Constantly, feels like.
Right. So having a resource that specifically incorporates those changes, as the source suggests this one does, well, that's essential for best practice. You need that currency.
We also mentioned something about a practical scenario-based approach. How does the source describe that working? Does it give examples?
Well, it doesn't give super specific examples in the excerpts we saw, but this feature sounds incredibly useful for actually applying the knowledge, not just knowing it.
Right. The material says it includes real-world scenarios. The idea is to bring the challenges of trauma care to life, right there on the page.
Okay.
And it's designed, apparently, to help you hone your decision-making skills you'd use in actual clinical situations.
So can you give us a sense maybe of the kind of scenario the source might be hinting at, based on what else it says?
Well, thinking about the description, it mentions covering, assessment, triage, decision-making, all that. So you might expect scenarios something like a patient arrives from a high-speed car crash. apparent chest trauma, decreasing level of consciousness, what's your immediate assessment strategy, and crucially, how does that guide your very next intervention?
Like putting you on the spot.
Exactly. The source implies these scenarios push you beyond just theory into, practical application, often under simulated pressure.
Okay, so who is this book actually for? Who's the target audience here?
The material presents it as pretty versatile, actually. It suggests it's ideal for, well, a whole range of professionals.
Like who?
Seasoned practitioners, maybe, who need to stay sharp, keep up to date, residents who are deep in their training, really learning the ropes, and even medical students just getting their foundation in emergency and trauma care.
So, quite broad then.
Yeah, essentially, it seems pitched towards anyone involved in that clinical space, anyone dealing with trauma patients.
And it sounds like you could use it in different ways, too, not just for studying.
Exactly. The source material describes it as being useful for structured study, like, say, preparing for certification exams. ATLS certification is specifically mentioned.
Makes sense with the title.
Yeah, but also potentially as a quick reference tool, something you might perhaps grab in a clinical setting, or even just for a general refresher on the core ATLS essentials if you haven't dealt with a major trauma in a while.
And the author, Dr. Atef Ahmed, the source describes him as a renowned figure.
Yes, renowned in trauma medicine and also medical education. That's how he's described. And having an author with that kind of background, as highlighted in the source, well, it definitely adds significant weight, doesn't it?
Sure, expertise matters.
You're getting insights, supposedly directly from someone who's deeply embedded not just in the field itself, but also in training others within it.
So if we pull all these different pieces together,
Mm-hmm.
what's the core value proposition? What's the main message the source materials are presenting about this book?
It's really portrayed as much more than just, a standard bright textbook.
Right.
It's framed as a tool, one specifically crafted for active learning, for really reinforcing knowledge through those detailed why explanations we talked about, and then helping you apply it through practical, realistic scenarios. It seems designed to be a kind of go-to resource for staying sharp, staying current in what is undeniably a complex, high-stakes environment like trauma care.
And looking at the wider scope mentioned in the material we reviewed, you see terms like trauma management, resuscitation, assessment protocols, triage, decision-making.
Yeah.
It clearly situates this book right within the fundamental pillars of the field, doesn't it?
Absolutely. It suggests the resource covers that essential language, those core processes that you absolutely need to master if you're working in trauma.
Okay, then. Let's wrap up our deep dive on Dr. Atef Ahmed's book, 100 Questions and Answers in Advanced Trauma Life Support.
So we've explored how this Q&A guide is presented, based on the sources, as a comprehensive, up-to-date, and really practical resource for medical professionals focusing specifically on ATLS.
And its strengths, according to that material, really seem to lie in that detailed Q&A format, the one that explains the why, not just the what.
Right, and the use of those real-world scenarios to build practical skills, plus its commitment to integrating the latest evidence.
It's clearly positioned then as a valuable aid for learning, maybe quick reference, and certainly for rigorous preparation for the intense demands of trauma care.
Seems that way.
So here's a final thought for you, our listener, to consider. Think about that immense pressure, the split-second decisions that are required every single day on the front lines of trauma care. How does having access to structured, practical, and importantly, constantly updated knowledge resources, like the one we explored today, how does that fundamentally impact not just patient outcomes, which is obviously critical, but also the confidence, the readiness, the preparedness of the medical professionals providing that care? Really consider the absolutely vital ongoing role of deliberate learning and ready access to expertise in any environment where lives literally hang in the balance.